Men use testosterone replacement therapy seeking energy, strength, and renewed vitality. It's a legitimate treatment for low testosterone, a medical condition. But what if that therapy makes your sleep dangerously worse, or even triggers a new disorder? This is more than snoring. TRT can reduce total sleep time and increase periods of low oxygen. The danger extends past your airway, potentially thickening your blood and elevating stroke risk. We will now break down how TRT affects breathing, who is most at risk, and the steps to stay safe. First, the connection between testosterone and sleep apnea is a two-way street. One can worsen the other. Adding external testosterone into this system can be like pouring fuel on a fire for those predisposed. Who is predisposed? Key risk factors are older age, obesity, smoking, heavy alcohol use, or a family history. So we know there's a link. But how does testosterone physically interfere with your breathing at night? Mechanism 1 is your airway muscles. Testosterone can reduce their tone, making them floppy and prone to collapse. Mechanism 2 is in your brain. It can make your brainstem's breathing command center less sensitive to rising CO2. Mechanism 3 is physical. TRT can increase fat deposits around the neck, physically narrowing the airway. To recap, your throat muscles get floppier, your brain's breathing reflex dulls, and your airway physically narrows. Beyond physical effects, how can TRT disrupt other hormones that are meant to help keep your airway open? Let's see the real-world impact. First, dose is a factor. High doses can acutely worsen breathing disorders. Next is fluid retention, a known side effect. This extra fluid can accumulate in your neck, adding pressure. But the most dangerous amplifier is polycythemia. TRT thickens your blood, raising clot and stroke risk during apnea. With these risks in mind, could you be a candidate for these complications? Let's discuss the nuance. Remember that question about other hormones? Testosterone can suppress progesterone, which keeps a key tongue muscle firm. Now for the most surprising twist. For some men, TRT doesn't worsen sleep. It dramatically improves it. The difference is dosage. Restoring low T to a normal range can help sleep. Pushing it too high causes these problems. But feeling more rested doesn't mean you're safe. You can still have an increase in dangerous apnea events. Now we connect the dots to see a dangerous feedback loop. OSA lowers T. You take TRT, which worsens OSA, making low oxygen periods more severe. Knowing the mechanisms clarifies the solutions. CPAP works by propping open the airway that TRT weakens. This information is meant to empower you, not scare you. So, what is the action plan for managing TRT safely? Step 1. Before you start TRT, demand a sleep apnea screening with a tool like the Stop Bang questionnaire. Step 2. Ongoing monitoring. Your doctor must check hematocrit levels and intervene if they rise above 52%. Step 3 is integrated treatment. This often means using a CPAP machine to keep your airway open while on TRT. Step 4 is what you control completely. Lifestyle. Weight loss is a potent treatment for sleep apnea. TRT can be a powerful tool, but it interacts with your breathing and blood in ways that demand careful management. Take this knowledge to your doctor. Discuss your personal risks. Be a partner in your own healthcare.